Ambulance service, is the patient breathing?
The guy is in the bin. It's a bit abnormal.
I'm in severe pain and I can't stop being sick. I'm red hot.
He's in a bad way. He's fell over and he's cracked all his hip.
RTC!
This is a typical 12-hour shift with West Midlands Ambulance Service.
It's not like a normal job.
Nice and steady.
What's happened then?
In that time,
Stop.
it receives over 2,000 calls for help.
Does she still have the knife on her?
I'm staying right here with you until we get the ambulance there, OK?
From a population of 5.6 million,
You are with people for the best and worst moments of their lives.
Can you lift this leg for me?
Anything like this happened to you before?
You might have broken it, you might have dislocated it.
filming simultaneously with 7 paramedic crews.
Oh, sounds nasty. Yeah, Roger, we're on the way.
But don't be afraid to call us, please.
This is life on the front line.
I'm back.
If we don't get to a patient on time, it can cost lives.
It's 6:30 a.m. and the paramedics of West Midlands Ambulance Service have had to battle through the elements just to get to work.
It's a bit fresh, though.
Yeah,
It's a bit windy.
It's a rainy, miserable day today, isn't it?
It is, and have you seen the forecast for today?
I've purposely not looked, to be honest with you.
Wind at about 45 miles an hour later, so...
45 miles an hour?
A breezy one, mate.
A breezy one.
Breezy day at West Midlands.
Right, let's do it.
Yeah.
Oh.
A paramedic's job is very hands-on, but when it comes to DIY, are they just as handy around the house?
Who did my drawers and the drawer didn't go in right?
You did your drawers and the drawer didn't go in right.
Did it yesterday.
No.
Yeah, Mike did it yesterday.
Did it yesterday.
I am the handiest person that you need to know.
Can't you fix things with a hammer and duct tape?
Don't even need that. Baling twine.
Baling twine.
That is it. Fixes everything.
Look, if something needs doing, like, I'll attempt it myself.
I wouldn't know how to change a fuse, not going to lie. I can just about change a light bulb.
Well, when does autumn start? Is it September?
Technically, summer's finished now, hasn't it?
Has it? Because it's every 3 months, isn't it?
Yeah.
Do you ever hear sirens in your sleep? What's your favourite ambulance siren noise?
The one you just did.
The one that goes...
Yeah, that one.
You're not more of a...
No. What, you mean slow?
Yeah.
No.
Or there's... That one's classic, I think.
Ambulance service, is patient breathing?
He is, yes.
And is patient conscious?
Yes.
What's the emergency there, please?
So this gentleman's a postman and he's his manager, so I'm just calling because he's in a bad way. He's fell over and he can't move. He thinks he's cracked all his hip.
Okie dokie.
What we got?
Got a job. Man in his 50s. Just says trauma at the moment. Is there any more information about this job?
Apologies, it's only got really limited notes on this one. It's male in his 50s. It says here that postman's fallen outside.
All received, thank you. It can be hard to plan what you're going to do on the way to any job when you don't have very much information. When someone's fallen, how have they fallen? And what injuries might they have sustained? Not reinforcements. He might have broken his leg. Hello.
Hello, mate.
What's your name?
Andy.
Andy. Hi, Andy. I'm Joe, and this is Ben.
Hello, mate.
Nice. Right, what's happened?
There's all sewerage down there.
Oh, yeah, I can see it.
56-year-old postman Andy was delivering letters when he slipped in sewage on the path. He managed to crawl onto the grass verge, but now can't get up.
It's
this hip that's gone.
Okay. You felt a pop, did you?
Yeah.
Can we move this leg at all?
I'll keep trying, but...
You keep trying, it hurts
there.
Are you in any pain? Have you bumped your head or anything like that? No.
Just a bit cold and feel a bit sick.
Yeah, of course. I'll just have a little feel of your neck there. And then what we'll do, I think we'll prioritise you getting inside and getting in the warm.
Yeah.
Okay, that feels fine.
I just apologise because obviously I've slipped in that.
Covered it. No, that's all right. As long as it's not yours.
No.
I did feel for Andy because it's not a pleasant way to injure yourself at all.
It's one thing slipping over, but to slip over in poo, raw sewage, I think is the worst. It throws up some sort of serious infection concerns
like
as well.
Contamination risk.
Yeah, if there's any open wounds or anything like that, it can be really serious. I'm just going to have a gentle feel of your hips here. Is it hurt for me to touch?
That's all there is.
Yeah, we'll get your feet together just so we can have a quick look. And we might scoop you up and onto the bed so you don't have to move too much. What we'll do is give you some gas and air, take the edge off.
Yeah.
Does this knee hurt?
It hurts, but it's fine.
There you go. Take as much as you like.
Ben gives Andy pain relief in the form of a gas that he can inhale.
Can you feel me touching you here?
Yeah.
And can you wiggle your toes? Yeah. Can you bring that leg up like that? No, that's fine. Don't worry if you can't. Don't worry if you can't. Yeah.
Obviously, when I've stood up, the pain just in my thigh was just...
Of course. You might have broken it, you might have dislocated it, you might have just pulled some muscles as well. It can be bad.
In case Andy's damaged his spine, Ben and Joe move him slowly and carefully onto the stretcher.
I'm not going to lie, this is probably going to be a little bit uncomfortable, right? We need to roll you very slightly to your right.
Okay.
Get the scoop under, and then it'll be the same.
Yeah.
We had to take time moving Andy because we didn't know the extent of his injuries and he was also in a lot of pain. We had to make sure that he didn't cause more damage to himself and also he was as comfortable as possible.
Ready, right, lift.
I'm hoping these grey clouds are going to disappear today.
We can but hope.
I don't want it to be cold and wet. I know I moan about it being too hot, but I prefer being too hot.
I can't do it too hot in there.
But he'll sit there with a body warmer or a coat on, and you won't take it off.
And?
Take it off. If you're too hot, take it off. If you haven't got it on and you're still too hot, then we can talk about it.
Or you could put some more layers on.
When I've already got two.
Put a third one on.
Behave.
Ambulance service, patient breathing.
Well, I don't know. The guy is in the bin. It's a male adult.
So the patient is inside a bin.
Yeah, it's inside a bin.
We're coming through the cardiac arrest. Patient inside of a bin.
Inside of a bin? Are they sending another crew in?
Yes, mate, that's all received. No worries. We got details.
A cardiac arrest in a bin is completely out of the ordinary. Has this person been injured by somebody? Has an assault taken place? Has he been thrown in the bin afterwards? What sort of injuries are we going to find?
I used to take a bit of first aid. Could get an early update, that would be appreciated, Emma.
Yeah, that's all received.
Right, need some gloves.
I've got some in my pocket. Where are we going?
In the bin?
Yeah.
Hello.
Hello.
What are you doing?
I'm sleeping down homeless.
Hey?
I'm sleeping down homeless.
You're sleeping in the bin because you're homeless?
Yeah.
In Walsall, paramedic Ian and technician Shawnee are with a patient who spent the night in a bin.
Yeah,
Okay, he's not dead. He's very much alive and talking to us.
But he's conscious, awake and talking to us, received.
So I initially opened the bin, I saw a gentleman inside there. It was quite a bit of a shock to me, to be honest with you.
Yeah, me too. I'm just really glad that he wasn't in cardiac arrest, because trying to get him out of there to work on him would have been so difficult.
So, somebody's come past and said that you're dead in the bin.
No, no,
Yeah?
no.
That's why we're here.
Yeah,
Yeah?
I'm only sleeping.
Where are you going to go tonight now?
I don't have any place to stay.
Are you cold?
Yeah.
Come on,
Right.
come and sit on the truck.
Come and sit on the
mate.
ambulance. Come and jump out the bin.
Don't pop the heater on. It's quite sad, isn't it, really?
It can be quite sad knowing that the only option he's got is to take refuge and shelter in a bin. He's got to be fairly low at that point, if that's his only options.
How long have you been in the bin?
All night.
Yesterday,
From yesterday.
because I needed to relocate.
You need to relocate.
To live in the space.
The patient says he's had to leave his accommodation and has nowhere else to go.
Just look at me.
Yeah.
How many fingers am I holding up?
It's 5.
5. Okay, it's not blurry.
No, a little bit,
A little bit.
because I have problem with vision.
You have a problem with your vision.
So his pupils were misshaped, weren't they?
They were a really unusual
Yeah.
shape.
I'd never seen that before. My initial thoughts was just to make sure that he wasn't having a bleed or there was no sort of head injury or something like that going on with him.
Do you know what day it is today?
Yeah, I know. Today is Monday.
Today's Tuesday. You're a day out. Yeah. Relax your arm.
Have you got a phone?
Yes, I have.
Okay. Have you got anyone you can call for some help?
No,
No family or friends?
no,
No. Have you got money to get a taxi or the bus?
no.
And what was the reason for you not having a home anymore?
Because I wasn't cleaning enough, because I'm not tidy. I have problem with vision and I cannot clean it very good.
More and more within the ambulance service, we are becoming more social workers. We are here to treat people medically. However, it is becoming more and more that we are treating people for a social and medical side of things.
Has a landlord told you to leave?
Yeah, so landlord said me that I should wait to leave.
Okay, but you do know that that landlord can't do that without a legal document.
Yeah, he gave me, but I left in the house.
What language do you speak?
In Polish.
Polish. Been a while since I've used this.
Shawnee calls one of the emergency services interpreters to help.
Can you ask him if it's a Section 21 that he's been issued?
Shawnee is told that the patient was issued with an eviction notice a week ago, which he's left at his accommodation.
He needs to take this documentation to the council for them to help to rehouse him. Okay, that's lovely. So thank you for your help. Bye-bye. Okay, so here, if you can get to the library or get internet on your phone, there's something called StreetLink. They're for rough sleepers, okay? They will try and sort something out for you. On this side, Birmingham Homeless Services. No, you take this, you take it.
Okay.
Okay? Go and get your paperwork.
You need to get your paperwork and take it to the council.
Thank you.
That's okay.
All right.
Right, be very careful. Yeah?
Yeah, okay, thank you.
All right,
okay.
no worries. Take
We'll
care.
open the door for you.
Shawnee and Ian let the man go with information on local refuges.
I'm a bit uncomfortable just leaving him. I feel sorry for him, to be honest. He doesn't know how to access people or anything. I feel like we've just abandoned him.
What can we do?
I know. We come across homeless people all the time, but I've never come across anybody who's been in the bin. That was a first for me. To be in a bin, you've got to think that you've got nowhere else to go.
Let's get back there.
Buddy, you can't stay in the bin.
I need, because it's very rainy for now.
Okay, should we go to the hospital then?
Should we take you to the hospital?
Yeah? We'll have a place of safety.
Yeah, come on.
Worried about his welfare, Shawnee and Ian take the man to hospital, where he can safely wait for an assessment for a refuge.
You could argue that hospital is an inappropriate place for him. There is no medical need for him to be there. However, it's not safe for him to be sleeping in a bin. So we've taken him to hospital as a place of safety, somewhere where he can stay warm, somewhere he can get something to eat and drink. How long have you had a problem with your eyes for?
A few years.
A few years.
Few years.
Few years.
Shawnee and Ian arrive at Walsall Manor Hospital.
Here we are. Come on then. You okay with the step?
The man will be safe here while support workers try to find him somewhere to stay.
I think driving to that, in my head, I was thinking, what on earth are we about to find? Because it's just unheard of, isn't it?
Well, thankfully, he wasn't in an arrest.
Well, yeah, he was okay. It's a bit of a shame that he's had to spend the night there because he feels he's got nowhere else to go.
Homeless.
Is this your normal round?
Yeah.
In Cannock, paramedics Ben and Joe are with postman Andy, who slipped and hurt his hip.
It's not a nice place to fall.
Yeah.
Especially grazing yourself and things like that.
Once Andy's on the ambulance, Ben and Joe can get a better look at his leg.
Will you just take some deep breaths on that? I'm just going to bring your feet together. Can you bring them together? Like, you know, move them in like that?
Yeah.
Does that hurt in that left hip?
I can just feel it up there, yeah.
I moved Andy's legs together so that we could relieve some of the pain. It also gave me a good indication as to whether he'd broken any bones. If you could score your pain out of 10...
So it's about 8 or 9.
8 or 9, so it's really hurt. What we'll do is we'll get a cannula, and it just means we can give you some stronger pain relief for the journey then.
Okie dokie.
To help control the pain, Joe gives Andy morphine intravenously.
It's going to be a sharp scratch, okay?
That was bad, and I got stung by a wasp on Friday on my neck. Cracky man, that was the worst thing.
Oh, that's not very nice.
No, it was terrible. It swelled up like a cricket ball on my neck.
Really? How long you been a postie?
33 years.
33?
Yeah, I was a miner for 7.
Oh, yeah. Okie dokie, Ben. Where were you a miner? Where were you in the pits?
At Leal Colliery.
Oh, Leal, yeah.
Yeah, left school, went straight there. I'd rather be out in the fresh air
than
underground.
Not many people can say that they've worked in the same job for 33 years and to be a miner beforehand as well. They don't make people like they used to.
Andy arrives at New Cross Hospital in Wolverhampton.
Stand clear. Ramp is in operation.
Let's go.
Only an X-ray in hospital will show if Andy has fractured his hip and how long it'll be before he's back delivering the mail.
Poor old postman, eh?
Yeah.
Hopefully, it's not... He hasn't damaged himself too much.
No, it'd be interesting if we get back later to find out.
Yeah, find out what happened.
What he's done.
Postmen, I reckon, are the glue that holds society together, you know. How else would you remember your birthday?
Very true.
Why do you have that?
Because Taz is awesome. He's a bit like me, isn't he? He's just hyperactive and doesn't really make sense. It's uncanny, isn't it, the resemblance?
I mean...
That's why I like Taz, Because I remember watching it as a kid. Do you remember? I don't know if you're probably too young for Taz, aren't you?
Tasmanian Devil?
Yeah.
I'm not too young.
What cartoon character would you be? Because if I'm Taz, you will be someone else.
I'd probably be the Roadrunner. Because I'm literally going around.
Just travelling at 1,000 miles an hour all the time.
Yeah, I don't stop, do I?
No, you don't.
No.
Ambulance service, is the patient breathing?
Yes.
Is the patient conscious and awake?
Yeah, it's me. I'm in severe pain and I can't stop being sick.
And where does the pain first come on when you feel it?
On my side and it goes to my stomach and...
Do you feel a normal temperature to touch there?
No, red hot.
We have been redirected immediately to 57-year-old female with abdominal pain. She's vomiting coffee grounds.
Oh.
Severe crushing, aching pain in chest, back or abdomen.
Okay.
When we say coffee grounds, it looks like instant coffee within your vomit. That can indicate a bleed in the stomach, which can be quite serious. Dankeschön. What do we call you, sweetheart?
Dion.
Dion, nice to meet you. Dion. Mine's Nigel. That's Amelia. How can we help today, chick? What's going on?
Severe pain.
Severe pain?
I stop being sick. Do not suffer with spina bifida.
Okay.
And I've been suffering loads of kidney stones.
Kidney stones, okay.
Severe pain and constant vomiting led 57-year-old Dion to call 999. She was born with spina bifida, putting her at a higher risk of developing kidney problems.
Did you wake up like this morning?
No.
It's just gradually got worse through the day. Spina bifida is a condition which develops before birth, which is basically where there's a gap between the vertebra and the spine, and it can cause the spinal cords to become trapped and can cause issues with nerves throughout the body.
Damage to those nerves can stop the bladder from working properly, leading to kidney problems and pain.
How's your waterworks? More than normal, less than normal, about the same as normal? Less. I know this probably sounds like a silly question. Score the pain out of 10 for me. 10. Okay.
We're on board with 7 paramedic crews simultaneously as they work a typical 12-hour shift across the West Midlands.
Right, let's pop this in your ear.
On the outskirts of Walsall, paramedics Amelia and Nigel are with Dion. She's been vomiting uncontrollably and has severe pain in her lower back.
My trainer thought already it's a kidney infection. When I had a feel, it was quite obvious that it was in and around her kidneys, so that would lead me to straight away think a kidney infection or kidney stones. I think the best course of action today, with the amount of pain you're in, okay, is to pop you up the hospital. All right, just to make sure this isn't more kidney stones. I can't imagine the amount of pain she was going through, but I think you could clearly see on her face that she was in a lot of pain and she was struggling. I'll just grab a bandage out for us, please.
Hard deposits that form inside the kidneys are called kidney stones and can be very painful. To ease Dion's pain, Nigel places a needle in her arm so drugs can be given intravenously.
With your spina bifida, sweet, are you able to still mobilise and everything as normal? Don't you need aids or anything like that?
I can walk a bit, yeah.
It's not painful or anything, is it?
No.
Let's get this sorted. I know, sweet. This stuff, honestly, when paracetamol goes into your vein, it's really good stuff. I've seen people that have got like broken hips and all sorts. Like within 5 minutes, they're a lot more comfortable. Nice little bungalow, this. It's quite spacious.
It's a 3-bedroom. There's only 1 3-bedroom in this.
3?
Yeah, because that's why we moved. Because my husband died when we moved in, more or less. Yeah,
Oh, bless it.
So,
How long ago was that?
it's been about 5 or 6 years ago.
I think Dion has had a bit of a tough time with her husband dying as soon as she moved in to the bungalow. So I think that she's had, as well as her own health, a lot on her plate to deal with. As you are now, what would you score the pain out of 10?
6.
About a 6. Okay. Well, that's a good start. Coming in the right direction.
With the liquid paracetamol starting to take effect, Amelia and Nigel prepare to move Dion to the ambulance.
Your chariot awaits you.
Right. Hold on to me if you need to. I don't charge.
Okay.
Much. Ready, steady, roll. Look at that. Smooth like butter. Right, when you're ready, nice and steady.
Oh, it's coming. Nice and steady. Oh, God. Just hold on. Hold on. Sorry. It's fine. Hold on, I'm sorry.
Have a second there first. That's it, buddy.
Even with liquid paracetamol, Dion is in a lot of discomfort. So Nigel gives her one of the strongest painkillers they carry, morphine.
How's that pain doing now? If you're in that much pain, we need to get to the bottom of what's causing it. So it was imperative we took her to hospital so that they could find out what was causing this pain.
On the 40-minute journey to hospital, Nigel keeps a close eye on Dion's pain levels.
Just gonna give some more morphine, Amelia. Take it steady.
Okay. I can't go.
I know, sweet, I know. I can only do so much to try and get rid of the pain, though, okay?
Oh, this is worse than having a baby, this is.
Do you know what? You're not the first person to say that to me when it comes to kidney stones.
My son was £9.9.
Wow. Bit of a whopper, then.
He was.
Let's give you this last little bit, all right?
Yeah.
Kidney stones are probably one of the most painful conditions, and I felt really sorry for Dion because until those stones are moved, there's not much we can do besides try and manage that pain for her. All the morphine I can give you. Right, so what's your pain score out of 10 at the moment?
At the moment, it's about a 5.
About a 5. Okay, good. So we're a bit more comfortable now.
Yeah.
Dion arrives at New Cross Hospital in Wolverhampton.
We have finally landed.
Right then, hold on to your bag. Hold on to your bells and whistles.
With her pain under control, doctors will investigate if kidney stones are once again causing problems for Dion.
Well, she was in a lot of pain now.
I know, she was. I felt for her though, like losing your husband 5 years back, struggling, you know, not being able to leave the house much. It's not pleasant. Hopefully she can get her back out quick, shortest route possible without passing go. Get her back home.
Try and live a normalish.
Yeah, absolutely.
Like Dion, most journeys to hospital start with a call to 999. At West Midlands Ambulance Service, there's nearly 1,000 people who respond to those cries for help.
And is a blue light emergency response required for this patient, Doctor?
Stay nice and calm so we can help you.
Each call assessor answers around 65 calls in any 12-hour shift. But with every one, it's essential they gain the caller's trust.
It is vital that you build rapport with anyone coming through on the phone. It's the best way to get the answers that you need to get them the best help as quickly as possible.
Ambulance service, is the patient breathing?
He is, but very, very difficult.
OK, understood. Is he conscious and awake?
He doesn't seem conscious now. Like he's having a fit, Diane Bar staff, and it's a customer that's just fallen off a chair and grabbed his chest. He was having a pint at the next to...
Got you. And you think that he's fitting, is that right? You think he's fitting?
Yeah.
Did you say he grabbed his chest before the seizure happened?
Yeah, he did grab his chest.
The caller explained that the patient had grabbed their chest. This is important just because it will give the paramedics more information while they are en route and arriving, that there may be a possible cardiac involvement as well.
We need to go and send for a defibrillator, OK? So if you can send somebody off to the nearest one.
And he just got and grabbed a defib. Some customers just moving back out here, please.
Send her off now, and then you stay with me, and I'm going to stay on the line with you till we get some help there with you. Superstar.
I cannot express how much when the person calling in is calm, helpful, ready to action what you say, it really does aid the patient and us getting the right care.
I need you to check his breathing. Check that breathing for me.
His breathing's getting quite fast, but the sitting does seem to have stopped. She's got the defibrillator.
Brilliant. OK, just have it there. Now, all likelihood, we won't need it, but we need to have it there in these situations just in case the situation deteriorates. That's amazing.
His breathing is slowing down a little bit.
Brilliant. All right, so I take it he's on the floor. You said he went to the floor. Is he lying down?
Just stay there, please. Don't try and get up. Just stay there. You're OK.
Roll him onto his
I
side.
already put him in recovery.
Oh, you're a legend. You're very good at this. Just let him know that an ambulance has been arranged and he's in safe hands, OK? When it became apparent that the patient was responding and was moving and was sitting up, it's now unlikely we would need that defibrillator. It's always a huge relief.
Ambulance is here now. Yep, so they've just got out the ambulance. They're going to drop things now.
Super. You are a superstar. You have earned yourself a cup of tea.
Calling about yourself or someone else?
Someone else. This morning I went up to do A&E because my son started with cold-like symptoms. He'd started sucking in under his ribs. He's just got progressively worse and now he's started to suck in at his throat.
So would you say he's not breathing in normally at the moment?
No, not how he normally would now.
We've just been given a 3-month-old little chap, and it says shortness of breath and cold symptoms. So it's not that far away, it's only about 8 minutes away. Yeah.
When you get a job that comes through involving a young child, especially a baby, you got all sorts of things going through your head, especially when it comes through, they got a breathing problem. You're wondering, what is it? Is it a chest infection? Is it something more sinister than that? So we need to get there and assess this child as soon as we can.
My name's Dave, and this is Mick. I'm Mick. Is this the little one we've come for?
It is.
You OK? Right, what's going on, Mum?
He's had a bottle at 7 o'clock this morning, coughed, choked, vomited it all up straight away.
Right.
And he has bouts of sucking in at his ribs.
Right.
When 3-month-old Jax was sick and struggling to breathe, Mum Charlotte called for help.
I find when you go to babies, you can see different signs with them. Blue lips, sucking in at the ribs, sucking in on the neck, the abdomen.
Yeah, one of the big ones is when they're quiet, because you don't expect, when you go to a baby, you don't expect them to be lying there quiet.
No.
And not doing anything. To me, that's a worrying sign when they're like that.
His chest is lovely and clear anyway. He does feel quite warm.
Dave checks Jax's temperature to see if he has an infection.
Come here. Yeah, absolutely. I totally agree.
5-year-old Bailey is keen to know what's going on with his baby brother.
37.
37.
Fantastic. Thank you, little man.
Jax's temperature is normal, so an infection isn't the culprit.
Come here, little fella. Well, he is definitely alert.
He is, isn't he?
Hello.
Are you big brother, then?
Yeah.
Yeah. Have you got somebody that can look after little one?
I have. I can get my mum to come and get him.
It's only because the age, with him only being 3-month-old, we have to pop him in just so he can get seen by a proper paediatrician, OK?
I don't want a lot in life. I want an island, as in a kitchen island, not an actual island.
Oh yeah, I don't want an awful lot, just an island.
If I get that in life,
Sorted.
sorted.
So you can stand there and like do your dishes in the middle of the room.
Yeah, and hot water tap.
Oh, they are fancy actually. Yeah, I do like them.
Yeah. You don't have to keep boiling the kettle.
Dreams.
Just go to your tap.
Dreamy.
Calling about yourself or somebody else today?
It's about my husband. Tried to get out of bed this morning and he's fallen on the floor and I can't get him up. He's all shaky and he's got a temperature. He's just stuck with his legs underneath him. I've been trying to get him up, but of course I can't.
We're 86-year-old male with a UTI fever and he's had a fall this morning.
He's going to be red hot. The heating will be on because it's cold.
Yeah, that's why I'm taking my coat off already. It's like, I know it's coming.
I'd say 100% of elderly people have the heating on.
Yeah.
All year round?
Yeah, aye. Whether it be summer, winter, makes the difference. I think they've all got their heating on.
Yeah, and then as soon as they get ill and feel cold, you turn it off.
Up even more.
Yeah.
Yeah.
This looks like it's going to be a nightmare to get out of.
Yep.
Bungalow, though. Love a bungalow.
Oh, bungalow. Big fan. Big fan. Oh. Good morning.
Hello.
Here he is. I see feet. Hey up, mate.
Hello.
Hello, young man. My name's Joel. What's your name?
John.
John.
I've just got no use in my limbs.
No strength in them.
No.
86-year-old great-grandfather John fell getting out of bed and now can't get up. Wife Shirley is with him.
Can you move your legs? Well, that's a start as well. Good. You can set them back down again.
John was on the floor, so he looked very uncomfortable. Nobody wants to be sitting on the floor for too long. And he was also very hot to touch, so I knew we needed to get him up quite fast.
Oh, cooking. So you're cooking. Have you had some paracetamol today?
Yes.
No, you haven't, John.
No, there it is yet now. 39.5.
Numbers look all right from what I can see at the moment.
In Stoke, paramedics Mick and Dave are with 3-month-old Jax. He's been sick and struggling to breathe with a bad cold.
He's interacting with, yeah, you are. You know what we're talking about, don't you?
We took Jax to hospital due to his age. We have a policy under 12 months that all babies attend A&E and are seen by a paediatric doctor to rule everything out and do any other tests that we can't do in the community.
So I tell you what, if all my patients were as good as you today, I'd be well happy. Nappy's been okay, Mum.
Yeah, he's not having as many wet, but that's obviously because he's not drinking as much.
Yeah. Doesn't appear to be any sunken fontanella.
So when we assess children, one of the things we look for is dehydration. With Jax, we wanted to check he was not dehydrated, so we palpate what's called the fontanelle. It's the soft spot on the top of the head. If it's quite sunken, it does indicate that they're quite dehydrated. With Jax, that wasn't the case.
Right, Mum, I'll let you dress him.
Okay.
I'm all fingers and thumbs. What's your rabbit called?
Nala.
Nala? Oh, it's a nice rabbit. What do you feed her?
Carrots and beans.
Carrots and beans. Do you know why rabbits eat carrots? Helps them see in the dark.
I think it can be quite helpful if patients do have pets, because you can sort of bring the pets into the assessment.
Yeah, because it takes their mind off.
It takes the mind off things.
Especially if they're hurting. And see the older siblings, they'll talk to you about their pet as well.
Right, are you going to look after the rabbit? Right, so when I come out again, look, how big's Nala going to be? Is she going to be like that big?
Massive.
Massive, like that big?
Yeah.
Fantastic.
Charlotte's mum, Joanne, arrives to look after brother Bailey.
You got everything you need?
Yeah.
If you need anything else, just give us a bell.
Be good, please. Hello.
That's it. It's not going anywhere. Okay.
A lot of people don't like crying babies. As paramedics, I love the sound of a crying baby, purely because it tells me they've got a good airway, they're alert, they're aware of what's going on.
Here's that nice little smile again. My mum once told me it was my voice that calmed children down because it resonates.
After a 13-minute journey, baby Jax and mum Charlotte arrive at Royal Stoke University Hospital.
Stand clear. Ramp is in operation.
Right.
How's a little chappy?
Sound asleep.
In A&E, the paediatric team will investigate why Jax has been so short of breath and what's causing him to be sick.
What a lovely little kiddie.
Young Jax.
Tell you what, I was surprised that he took to me, because normally I frighten kids.
He had a cracking little smile, didn't he?
He did, yeah, he did. His brother was very good as well, and that rabbit.
That rabbit.
Oh, never seen that was a fair old sized rabbit, that was.
Are you struggling to go for a wee?
Yeah.
Aye.
Also in Stoke, paramedics Kaylee and Joel are with John. He has a urine infection and fell getting out of bed.
Your blood pressure's good. Everything else is looking pretty good other than that temperature of yours.
The fact that he was stuck on the floor shows that he's probably not got the strength to get up, so this water infection has probably made him feel really weak.
Kaylee and Joel need to get John's temperature down, but before they can do that, they must get him up off the floor.
You ever had to go on one of these before, no? Your lucky day then, really. They make it easy for us, even put numbers on them.
Yeah.
As long as you can count to 4. So.
You haven't even got to do anything.
Yeah.
Kaylee and Joel use an inflatable cushion to lift John slowly and safely.
Kaylee's going to plug us in, and then you're going to take my hand. I like your dollhouse, John.
Yes.
It's nice, that is, isn't it?
Great-granddaughter's room.
How old's your great-granddaughter?
8.
Is she?
I thought that was yours, John. When I first seen the dollhouse in John's spare room, I kind of had a funny feeling it wasn't for him, and I thought that was quite sweet, really.
Has he had UTIs before?
Has he?
Had UTIs before?
Yeah, he
Keep
has.
walking for me,
A
John.
long time ago, but he was bad then.
Spin round then. Keep going. Keep going.
Come on.
Keep going.
Dance with me. There you go.
That's it.
We made it.
I just got no use in my legs.
Yeah.
John was recently diagnosed with a UTI, or urinary tract infection. Although he's been prescribed antibiotics, his temperature is still high.
So when was the last time you had some paracetamol?
Did you have any in the night? No.
2 of them, please. UTIs can be very serious because they can turn into sepsis, and that's kind of the worst end of the infection that you can get. So they can become really serious if you don't treat them correctly and manage them properly.
Is that what you should be having then?
Yeah.
Oh, yeah.
Every 4 hours. Paracetamol's very good for getting your temperature down.
Oh, it's marvellous, isn't it?
What, the cushion?
Yeah.
Saves our backs and it saves mauling people.
Oh,
and
yeah.
it's just,
Yes.
yeah, it's very good.
Once we get you cooled down, you'll feel a little bit better, I promise. Okay?
I've had water infection before, but usually 2 days.
Yeah.
And it was all right.
You've only started your antibiotics yesterday.
Yeah.
They take a good 3 days to kick in, and with your temperature as well.
That's it.
We're normally out by now, aren't
Oh,
we?
yeah.
Out where?
10 to 8.
What do you do?
Where'd you go?
I'd have been in Greg's now having my sausage back.
Oh, do you normally go to Greg's, do you? Nice.
Yeah, we love Greg's on a Tuesday.
Good
We're
idea.
there for Tuesday,
Yeah.
10.
She'll have a bacon back, but I have a sausage back.
They're going to be missing you today then, aren't they, really?
You've got a better life than me.
I'm not used to being poorly.
So the biggest thing is we need to get your temperature down, all right? Everything else is pretty steady. And also, I need to make sure that you're safe to stay here whenever you're walking about, because I don't want you falling again, okay?
No.
That's the big thing.
Kaylee has also suggested a more practical way to lower John's temperature.
Yeah, it'll just keep him nice and cool.
I never thought about bringing this in, yeah.
Yeah.
I got a cloth and wiped his face.
Yeah, that's good as well. With the temperature, you've got to be cruel to be kind. He's going to be feeling cold, but your body tricks you.
But once we get you cooled down, you're going to feel so much better for it, okay?
If John's to avoid a trip to hospital, his temperature needs to come down.
Okay, John, your temperature's 37.9 now.
Hey.
Excellent job, excellent.
Fixed you.
Fixed you now. But your temperature's down enough, so I'm happy about that. If you become unsteady on your feet again, just ring us back straight away, okay?
Yeah.
Oh, you are well looked after, aren't you?
I am.
Yeah.
We were glad we could leave John at home because he already had antibiotics in place. We don't like taking people to hospital unnecessarily, and it was nice to be able to leave him at home with his wife, which is where he wanted to be.
Well, thank you both for coming
You're welcome.
so quick.
Oh dear. Enjoy the rest of your day.
Look after yourself, okay?
I hope I'm still getting about like that at that age.
Oh, damn right. What, 86-year-old just...
Oh yeah, what do you do on a Tuesday? Oh well, we head out for a bacon and sausage bap at Greg's. That's our usual Tuesday.
Baby Jax, who'd been sick and struggling to breathe, was diagnosed with a chest infection known as bronchiolitis. After observations, he was allowed home that same day. Dion, who had severe pain in her lower back, had a CT scan. This showed a kidney stone was the source of her pain. She was discharged after 3 days and had the stone removed a month later. And postman Andy, who slipped on his round, had x-rays in hospital. These showed he hadn't broken his hip. Despite bruising and pain, after 3 weeks, he was back delivering the mail. Next time, a man is found collapsed and unconscious.
He's got a pulse, he's breathing, he's just not responding to.
Come on, buddy. He's unconscious, he's not responding to us. It's clearly unsafe for him to be left where he is.
Paramedics are called to a patient who's had a suspected stroke.
He's got this kind of what we call unilateral weakness, which are kind of main symptoms of a stroke. Walter needed to be seen by the stroke team specialist in hospital urgently.
And a fall leaves a gardener with a serious leg injury.
Gas, 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 gas.
He's got a severe break to his femur. He could potentially lose a lot of blood, so we need to get him gone.